we looked at a group of 18 to 45-year-old African American women, and what we did was we had them to complete a food frequency questionnaire, the Willett African American Food Frequency Questionnaire. We also measured vascular dysfunction, and we collected their blood for several different measures of inflammation, of oxidative stress, and endothelial progenitor cells. And one of the things that we found that was very interesting was that the women in this study, as compared to a larger population-based study that was done in the past, the Nurses' Health Study, did not really adhere to the DASH diet as well as that group. And the different things that we looked at, for instance, was their intake of fruits and vegetables. In our group, it was 1.27 versus 2.19 in the Nurses' Health Study. We also noticed that they had a higher intake of sodium compared to that referent population. And when we looked at the relationship between their dietary intake or their adherence to a DASH type score and vascular dysfunction, we actually found a significant relationship between poor adherence to a DASH type diet and vascular dysfunction. And this relationship was not changed either by blood pressure, age, or body mass index. So we think that that's pretty significant. In terms of a take-home message, the big thing that I would like for my patients to know is that it's very important for them to consider increasing the amounts of fruits and vegetables that they take, nuts, legumes, whole grains, and low-fat dairy, simply because we're starting to see a relationship with vascular dysfunction even in the absence of cardiovascular disease. And one of the other things that we found, which was interesting, was when we broke out these young women, 18 to 45 years of age, by quintiles of adherence to DASH type diet, though there was no difference. So whether they were lean or obese, in general, they just were not adhering that well to the DASH type diet. Reasons for this are many. We can speculate about several of them. One of the main components of the DASH diet is intake of low-fat dairy. We do know that in our population there tends to be an avoidance of dairy products because of lactose intolerance. So, offering people alternatives, things that they can tolerate, but encouraging them to try to look for things that work would be important in this population.